We are live, Chair.
Brilliant. Thank you, Carrie-Anne. Good morning, everyone. Baradar Paub, Crystal, welcome to our Health and Care Scrutiny Committee today. We've got a couple of main items on the agenda, but first of all, have we got any apologies, please, Carrie-Anne?
Yes, Chair, we've got apologies from Councillor Josie Ewing, Councillor Ange Williams, and Officer Nina Davis.
Okay, thank you. Has anyone got any declarations of interest in terms of the items on the agenda today? Nope. Disclosure of party whips. Anybody been whipped? Nope. We are parking the minutes one to the next one, partly because I need to have a more detailed look at them, and the minutes need to be shared in the agenda. So we'll have a look at those our next meeting. So that brings us on to the next two items. Just before I rejig the agenda item, I know Councillor Richard has got to leave by 11. So I'm just going to ask Sharon Powell and Richard, do you mind if we bring yours forward before the prevention of falls work?
That's fine with me, Chair.
That's okay. Okay, well, before we get on to that, just like to welcome officers to the meeting. We've got Sharon Powell from Head of Children's Services and Sharon Fruin, Head of Adults, and also three portfolio holders. We've got Councillor Sian Cox, portfolio holder for adults, Councillor Sandra for children's, and Councillor Richard in his capacity as the lead for safeguarding. That's right, isn't it, Richard?
That's right. Thank
That's
you,
right.
Amanda.
Right. So welcome to Scrutiny, and I will hand over to Sharon and Richard on the corporate safeguarding activity report. We have had a pre-meeting on this and have got some questions in terms of there's a bit of a lack of documents embedded in here to what we've had previously. So I know we're going to be asking you about, where you were referring to updates being provided in the board, were they separate documents, or are you able to give us an overview of those updates? But on that note, I'll just hand over to you if you want to talk through the headlines from this.
Okay, Boradar, good morning, everybody. For those of you who haven't met me before, I'm Sharon Powell. I'm the Head of Children's Services, and Nina Davis, our Statutory Director, is on leave today, so she's asked if I will take you through the report from the recent Safeguarding Board. So the Safeguarding Board is a corporate responsibility in terms of its roles and functions across the whole of the council. And you will probably recall and remember that it's been on a bit of a journey over the past few years in terms of its starting point, when there were matters that needed to be addressed around its role and function, and actually to the journey of where it is today. So there's recently been an audit in terms of the review of the actual role and functions of the Safeguarding Board as a whole, but we don't yet have that report. So when we do have that report, I would expect that to come through to Scrutiny Chair so that you can have sight of that and scrutinise that in terms of its role and function. For today, we've got a report on an update of September's meeting. So they're held incredibly regularly in terms of that, and they are very well represented from across the whole of the council in terms of every role and function across the council is represented at that meeting. So that's been a big turning point in terms of making sure that the roles and responsibilities, the accountability of safeguarding as a whole kind of spreads right through the whole organisation of the council. So in terms of this particular report, there were a couple of things that we kind of looked at in terms of more specific things. Some of those have actually come through to scrutiny previously, but I'll take you through the report in the sense of the regulatory tracker part. So point one of the actual update that was shared, that was all noted, that this was on track in terms of that role and responsibility, in terms of the arrangements, in terms of that. I appreciate the details aren't in there, and that might be something that you referred to, Chair, in terms of the specifics. But in terms of the actual organisation being on track, it is agreed that that is on track. We talked about the Director of Social Services annual report that has been through the health and care scrutiny process. You'll be well cited on that report. And whilst actually it is it's used AI in terms of translating for that report, what was fed out of the safeguarding board was actually, it's a massive document in terms of the actual director's report, and there's some kind of learning to be had to make that more child and adult focused friendly in terms of an easy read, etc. So that will be considered as part of the formatting of that report in terms of next year's or from this year's annual report. The terms of reference were looked at in terms of that to make sure that the board's purpose and function were held at accountability, and that was looked at in terms of various suggestions were around the improvement of the document and how that kind of could be shared in terms of emerging themes noted. So there will be a draft version amended, and that will come back for approval to the Safeguarding Board in December. So we looked at the Regional Safeguarding Board, and so this is really important in the terms of themes of learning, development for the council as a whole. So the Regional Safeguarding Board, which is called PASEA, has actually regional responsibilities for Powys, Ceredigion, Pembrokeshire and Carmarthenshire. And as a board, we meet very regularly. Sharon and I both sit on that board, and it looks at cross-cutting themes across all local authorities in terms of that regional lens. Some of the things that we've recently discussed at that board is the child exploitation strategy for Powys. So that has recently come through, Chair, to you in terms of health and care scrutiny. So we looked at that in terms of the corporate safeguarding board, in terms of what does that mean for Powys as a whole, what can other areas within the council actually action and be accountable for as part of that wider thinking and learning around child exploitation as a whole. So that's really helpful in terms of delivering that strategy, because it's very much should be a whole council approach to the kind of learning and themes stemming through the organisation in terms of individuals, roles and responsibilities, in terms of thinking and considering matters around child exploitation. We also looked at community practice sessions, outreach events, and the development of the ambassador programme, which is looking at all matters around consent, around healthy sexual relationships and healthy relationships and exploitation as a whole. So there was a conversation about all of that in terms of learning from the regional safeguarding board back into the local operational groups. So Powys has a local operational group, as do all the other local authorities. So those themes kind of run through from that regional level into that local level, but then actually come into the council in terms of the corporate safeguarding board. So there's a whole kind of route map of how that information flows in and flows back up. We looked at safeguarding in terms of housing. So there was an update on care leavers and homelessness in Powys, and the report highlighted efforts around housing as a provision, reducing the use of bed and breakfast accommodation. And that's really important in terms of a safeguarding perspective following the Southwark judgment. And the Southwark judgment was basically an investigation that looked into matters concerning for children and young people that were placed in bed and breakfast accommodation from a UK perspective, and recognising that it was inappropriate for children and young people to be placed in bed and breakfast provision. So that judgment is about ensuring that local authorities all adhere to their responsibility about reducing that need to place any young people within that bed and breakfast situation. So that's a really important comment in terms of the corporate safeguarding board, in terms of working in conjunction with our housing colleagues around reducing that particular aspect of safeguarding as a whole. And we looked at that in terms of details, in terms of that significant reduction in bed and breakfast that was used in the report. It reported that there was 46 households in October in 2023 and 26 households on the 9th of September 2024. So we kind of looked at that in detail in terms of what that meant, that it was great that those numbers have reduced, but actually we want to get that number even lower in terms of homelessness as a whole, but also looking at that element around care leavers and young people being placed in that situation as well. So there's been a lot of work with housing in terms of trying to promote that and make improvements, which is really helpful in terms of that overarching corporate responsibility. In terms of safeguarding and education, we looked at that in terms of electively home education and fixed term exclusions. And there was a discussion around the importance of safeguarding for learners during those exclusions and ensuring that exclusions are not a consequence of safeguarding issues at home. So what that meant was that you really don't want children to be excluded from school if there are particular safeguarding concerns within that family home, that often the school can be a place of safety. And it's really important that we acknowledge that and look at the information and data surrounding all of that so that we can work collaboratively within education services to support and assist and enable as many learners to be within the education process as is possible. In terms of the CE strategy and implementation plan, obviously you've been well cited on the CE strategy and implementation plan. So again, we just looked at that in more detail through the Corporate Safeguarding Board, looking at roles and responsibilities and accountability for different service areas and the council as a whole in terms of what that means. I mean, that's really important, as we talked here previously, around licensing, around just being more visible within community settings, around online learning for members of the public to engage in. So there's a whole wide range of opportunities and information that not only the general public can engage in, but also members of the council in terms of workforce as well as councillors. We always look at learning in terms of that cycle of learning that feeds back from the regional safeguarding board back into a local level. So there's always information available around learning from child practice reviews and adult practice reviews. Those review summaries get highlighted in terms of learning through, in terms of themes into the organisation, so that we can close off that cycle of learning and obviously learn as much as we can from those incidences that have arisen as a result of a child practice review or adult practice review. So some of those things that we looked at in the safeguarding board were around child exploitation, sexual abuse, the death and tragic death of a child, the emphasising the importance of multi-agency collaboration and that really important aspect of early intervention. And we looked at a child-first approach in terms of safeguarding practices, which basically means you just put the child at absolutely the forefront of absolutely any investigation, any assessment, anything that you're considering in respect of that child, as opposed to looking at it through an adult's lens. So there was a wide range of things in terms of learning from that, in terms of that fed back from the regional board through the local operational group into the corporate safeguarding board. So we set the meeting for the 12th of December and the next one is scheduled for the 13th of March. And that kind of gives you a kind of flavour really of the information. But I appreciate from what you highlighted at the start, Chair, that you've just got a highlight report from the actual corporate safeguarding board and haven't got those details of the specifics that were discussed in more depth embedded into there. And I think you said that you previously had that information in a previous update. So I will take that back to Nina in terms of that information being fed back to her. But I'll stop there because I've taken you through the report and there might be some questions from that.
Yeah, thank you. I think we have, for where you have been given a specific presentation at the board, I think we have had them embedded, so it would be helpful to have those going forward. I don't think we're asking for you to create any extra work. It's just, if the update is not a verbal one. Okay, over to you. Oh, Councillor Richard, did you want to add anything to this?
No, I think on the question of papers, I was just considering, I think it's important that you see the revised terms of reference when they come back to our next meeting in December, that you have an oversight of those if you haven't had that already. I don't think it's been written up yet. I think it was
No.
only discussion we had at the last meeting.
That's right.
But I think we need to make sure that we get it to you. The other point I was just going to make is that Sharon's report reflects the way in which corporate safeguarding cuts across the whole council, and it's not just children's services, it's not just adult social care, it's education, it's everything. And in a way, my role is there to particularly reflect that. I was thinking in terms of what Sharon was saying about exclusions, that there is perhaps sometimes conflicting responsibilities of a school to consider the safeguarding of their staff and pupils, which might lead them to a decision to suspend or exclude a child, as against the need for the council to be sure that that child is in a safe environment when excluded. And it demonstrates, there's sometimes conflicting pressures in the managing of one particular child.
Yep. Thank you, Councillor Richard. Okay, members, have you got some questions that you wanted to ask on this? Any further information that you would like today? Please put your hand up and it should come up. I should be able to see. Councillor Chris. You're on mute, Chris.
It's
Yep.
working on small screens, it is. I'm not on there, apologies. Thank you, Chair, and thank you, Sharon, for the a comprehensive report. It's given me a lot more reassurance once you've talked through on the. Just a couple of things, and I just wanted to see on the. I always look for reassurance in relation to this, and I get the sense that there is now a much more corporate ownership, as Councillor Richard just mentioned. It's crossing all segments of the authorities' aspects. Just in relation to the item 1, where you show that we are progress moving forward and we're on track. Can you just highlight how we're on track on the? I'm looking for specific things to be able to give me that assurances on the. And then there was a question then around the AI stuff. I welcome that because I do see that it can actually lead to potential costs savings being achieved. But is that just in relation to Welsh translation? And if so, how much are we saving in relation to that? And are we going to have any further detail regarding it? I do welcome the reduction in the bed and breakfast accommodation, as you mentioned. What further actions do we need to do to make that more sustainable so it reduces it down even further, as you mentioned? And I'll stop there, Chair. Thank you.
Thank you, Chris. Sharon and Richard, are you able to take those questions, please? Sharon?
You're on mute.
Yeah, apologies. I had different things open, so I was trying to get back to the screen to take myself off mute, so apologies. Yeah, in terms of the regulatory tracker, this relates back to every individual part of the organisation has to complete a self-assessment on their service area throughout that year. And obviously you will have sight of children's services and adult social care's self-assessment in terms of that process coming through here. But as part of that self-assessment, there's a specific requirement to look at safeguarding in terms of that specific self-assessment as a whole. So that's been something that is being brought in to ensure that safeguarding doesn't, like you said, Councillor Chris, doesn't just sit within the world of social care, that it actually is throughout the whole council and throughout all the organisation. So each service area, whether that is finance, whether that's properties, whether that's democratic services, whether that's ICT, everyone has to complete the safeguarding element of that self-assessment process. So that information then gets drawn through in terms of the overall information. So if there was particular gaps in a service area for whatever reason, that would get highlighted and then brought through up to the safeguarding board. And then that would be looked at in terms of that. So it could be things like communication, it could be things about delivering and signposting information around safeguarding as a whole. And even though there are many strands now corporately where that information gets fed through, it's about each individual part of the council ensuring that safeguarding as a top priority for their service as much as it is for children's services and adult social care. So for example, domestic abuse is a theme that we would expect to in terms of training. So the training around mandatory training, around the VAUDA SV training, all of that gets recorded in terms of the mandatory training elements, and all of that gets assessed and discussed and reflected at board level. So then if there are gaps in an area which aren't as compliant, then that will then look at a specific action plan in terms of that particular service area. Does that make sense in terms of how it all rolls through? So that's why it's showing green as being on track, is that the requirements around safeguarding as a whole are now embedded across the whole council's agenda, particularly through that self-assessment process. So if there was any individual matters then to come up, that would be fed through back up into the board level.
Okay, thank you.
Councillor Richard, did you want to come in on that at all?
No, that's fine.
In terms of the housing situation, obviously that's a really good trajectory in terms of going on a downward trajectory, but there is a recognition that there is still homelessness within Powys. So the housing team, in terms of their remit, are looking constantly at how they can improve those factors around families needing and requiring bed and breakfast. So that's an ongoing housing challenge for them in terms of having enough provision to be able to manage that, and that's why it gets fed into the board at board level. I guess if you wanted more specific information around that for this panel, then we'd need to get a report from housing around the specific information for that, Councillor Chris, to feed into here.
Okay.
There was
Thank you.
another strand to your question, and
yeah, it was about the AI and the
AI.
translation.
Yeah, so AI, whilst, you know, AI is amazing in the sense of what we know now in terms of using it, in terms of looking at information, being succinct, in terms of writing maybe a summary or part of a report for things. It does have an element of translation into the Welsh language, but it also has elements of translation into other languages too. And that's going to be really helpful for across the council as a whole, but specifically for children's services in terms of our unaccompanied asylum seeking children who have different languages depending on where the country of origin they've come from. That is going to be particularly helpful for us going forward in terms of being able to instantly translate a conversation while you're with a young person. The Welsh language, I'm understood that from some Welsh language, because I'm not fluent in Welsh language, but they're saying that it's 99.9% accurate in terms of its ability to translate into the Welsh language. And I guess it's something we're all learning with, and we're all kind of just reviewing on a regular basis to make sure that actually it is translating in the right way with the right dialect, etc. So I guess it's a process that we're learning as we're exploring using AI. In terms of costs, I don't have any specific costs today for you in terms of what that might look like, but I would anticipate that there would be some saving cost to that, particularly if you're thinking about translators, that you may not specifically need an individual to translate something if you can actually use a system of translation through AI.
Okay, thank you.
Thank you, Chris.
Do you want to come in on any of the points I raised?
Was that myself, Sharon?
Sorry, was that addressed to me? No, I'm fine. I think you've covered it.
Yeah. Sharon, did you want to add anything? Sharon Fruin, did you want to add anything on that response?
Yeah, it was only a small thing, just to share that we're working with Torvine Borough Council also to review how they've been using AI to assist with minute taking for safeguarding meetings as well. So we've arranged some contact with them to review how they're using it, to see if we can do that within our services safely and release some capacity.
So Chair, I'm leading for social care on a digital transformation agenda, which AI is part of that. So there's lots of different strands and areas of work that we're just testing out at this point in a kind of discovery way, looking
Okay.
to see what other local authorities are doing and how. I mean, if you want to report to come into scrutiny at some point, picking up on Councillor Chris's financial part of the question, happy to bring that at some point in the future if that's helpful.
Are other service areas doing the same thing, looking at AI across the board?
Lots of areas are looking at
I
AI.
wonder whether rather than it coming here, we have a future member development on how the council's using AI.
Yeah, I can take that back. Yeah.
I think because we probably need the information first before we look at whether or not we need to scrutinise it.
Yeah.
And the other
absolutely.
committees probably would be interested in the same.
Okay, I'll take that back as a comment. Thank you, Chair.
Thank you.
And it's all,
Sorry, go on, Chris.
it's also about looking at what are we spending now, and by bringing AI, what is then this cost savings coming back? And then how is that then being reutilized, that resource, to improve service provision going forward? Whether that's of a development of a new service or different equipment coming in, we have to then be able to show the return coming back, because sometimes what happens is we make a saving and that just hits the bottom line. It's not reinvested back into the service. And what I would like to see is that if the service is making that change, there also needs to be a reward system coming back so that the service can see that there is an improvement, because otherwise you just get less and less and less, and you'll be doing more for less and it defeats the whole object. This is about being more efficient, but then being rewarded for that efficiency, moving on with a development within the service. And that's what I would welcome a group looking at this more broadly to do that.
Yeah, and I think also when something I would be interested in terms of efficiency is not just like cost efficiencies, but say if you're using AI for note taking in safeguarding meetings, I would hope that would it's very difficult to take notes and ask questions and listen to answers. So if you don't have a clerk who's doing that and you're doing that yourself, are you as effective as a listener or a question putterer? Sorry, I can't speak today. So it's not just the financial efficiencies, it's actually, how effective you are and how you can use AI to make yourself more effective in a role that AI can't do. So great, thank you. That's very interesting. And if you could take that back, Sharon, that would be great. Councillor Sandra, did you want to come in on that point?
Yes, please. Thank you. I was just going to say that with regards to AI, I know that there's a tremendous amount of work in the background going on throughout everything that needs to be translated. As you know, I've got responsible for the Welsh language, and we're trying to promote it as best we can and improve it and make sure it's a stronger language to be used in Wales. But with AI, I'm very excited about the possibilities of this, because it learns as it makes mistakes, which is fantastic. But at the moment, everything that does go through the AI system needs to be proofread, so to make sure that it is actually actual, and not that there are no errors there. That's the bit that is slowing us up a little at the moment. That's the only thing, really. But the amount of possibilities that we've got are phenomenal, and it's just very, very exciting, and I'm sure that we will all improve as a result of the use of AI. Diolch yn fawr.
Thank you. Diolch, Sandra. Councillor Gareth.
Thank you, Chair, and thank you, Sharon, for the update, because before that, I thought this paper wasn't very valuable at all. In fact, it wasn't providing me any real assurance of where we are around safeguarding, and I think for future papers, as you said, that needs to be updated, because I don't I'm reading this as though I'm a member of the general public reading it from the cabinet, and I struggle to see what assurance this report is actually providing. There's not enough data in it. Can I just make a couple of general points before I ask a specific question? You use quite a lot of acronyms in here, and sometimes, for example, with Corporate Safeguarding Board, you say that in detail and then put the acronym behind, but other times it's not. For example, PLOG. I've got no idea what PLOG is. As examples, so I think there needs to be a common process used for that, assuming this is a general member of the public reading this report. The other thing, and you've got the table under item 1 around your assurance around where we are around safeguarding as an authority, but there's no evidence to any of the tables, to any of the columns. I don't know what some of those areas mean. Can I go on to a couple of specific points? Really good news about the bed and breakfast in housing, but I would have expected some mention of what the saving would be, if any, from reducing from 46 down to 23 families in bed and breakfast. And as this is a young people, I'd also expect some sort of narrative to say why we feel that's better on a safeguarding basis. If I can think of a scenario when if I'm in bed and breakfast, that means I'm most likely talking to somebody every morning when I'm having breakfast, etc. If I then go into my own accommodation, is my safeguarding levels improved or decreased? Just that sort of thing. But I think the financial aspect around that would be better. I think a little bit more details around the excluded pupils. Why is that so much an impact in safeguarding? In my mind, 2.6. Under 2.6, the CE strategy and implementation plan, it doesn't, that narrative doesn't answer the why answer to questions in my mind. What is the impact of implementing that plan? And the same on the CPR and APR. I would expect it to have some highlights of the main findings of that report. If I was sat in cabinet next Tuesday when this is considered, I'd be thinking I need a lot more detail in this report.
Will Cabinet get the embedded stuff as well as part of their pack, Sharon?
That's a good question, and I would, Councillor Sandra and Councillor Sean, obviously you're in cabinet, so you may know what you actually get more than I do in terms of those reports. I definitely take your points, Councillor Gareth, on terms of acronyms and headings and wanting more specific data so that you can have that level of assurance in terms of that loop back round. So absolutely, I will take that back to Nina. In terms of the savings that you mentioned as part of the bed and breakfast and the safeguarding elements, again, I will take that back in terms of specifics, and as well as the education information around exclusion of pupils in terms of that further data and information underneath. And also take your point on the impact of implementation of the CE strategy in terms of what is that impact going to be as a result of that strategy being presented at the Corporate Safeguarding Board. You want to see the cycle and loop of learning and engagement in that in terms of prevention, protect, etc. So absolutely. And again, with the learning from the CPR and APR, I think in terms of how the report is presented, you don't have the detail that sits behind that to know what those themes are, what the learning cycles of those are, etc. So absolutely, we'll take all that back to Nina in terms of that information from the report you've had today. Councillor Sandra and Councillor Sean, are you able to answer the question around the reports that go to Cabinet?
Sorry, can I answer that question?
Councillor Richard.
Sorry, yeah. Just to remind Scrutiny Committee that every member of Cabinet is a member of Safeguarding Board. So they will have had it with their Safeguarding Board papers. That doesn't necessarily mean that that will appear on the agenda of the full Cabinet meeting next Tuesday. But Cabinet members will have had access to reports through their membership of the board. But perhaps we need to clarify that in relation to full Cabinet, because the documents, of course, if they're on the Cabinet agenda, are then public for everybody to see.
Councillor Sandra.
Sorry, I just had a quick look, and this is exactly the report in the Cabinet next Tuesday is exactly as what we got today, I think.
Okay.
And I accept what you're saying about every member of the Cabinet being on the Safeguarding Board, Richard, but I'm also saying this is a report this is most likely the key point when members of the public will look at safeguarding around the Cabinet, and we need to make sure that information is provided clearly and succinctly. And, you know, as I said, I don't think this report is worth a lot without Sharon's supported narrative.
Can I just ask a quick question? Oh, sorry, Sandra, did you want to come in on that?
Yes, please. I was just going to say we do have a number of other meetings that are, you know, with lots and lots of reports. And as has been said, we sit on the corporate board meetings, etc. We have reams of papers there, so we've got the background of it all. But then when we come to Cabinet, it's narrowed down as it is here. And I take on board what has been said, because this is the actual document that does go to the public, and they haven't got that narrative behind it or the background reading. How we condense some of that to make it more open, which is what we're aiming for, it is something that I think is something, Councillor Richard, we might be having to consider in the future. So I thank you for that. It's very valid. It's as far as Cabinet members are concerned, they will have the background, but as you correctly say, other members who are reading this report won't have that narrative behind them. So it's very important what you said. I appreciate that, and I think it's something that we need to take away and discuss how we can bring more information there without overloading people as well. Diolch yn fawr.
Thank you, Sandra. Can I just ask a quick question about board in practice, and you know, how formal is it? Is it just present, listen, move on, or is there a dialogue and question and answers, and do you push for further information as board members? And you know, obviously that you can't every meeting look at every single topic that's ever come up at corporate safeguarding, but there are things which you'll each individually have interests in. One of the things that I'm interested in is the trends to do with homeschooling education. So that isn't on this month. So if I'd been on the board, I would have just been wanting to say, is there anything I need to be aware of this month? Are there any spikes, or do we think it's leveling off? Are those kind of questions asked at the board? How can you just give us a flavour of it?
Yes, so Chair, it's a board meeting as a standard board meeting with a set agenda, and there are always key areas on that agenda which relate to the themes of the highlight report. So there is always opportunity for stopping and reflecting on the information that is being delivered, and also questions and answers can be asked during the board process. So it is a formal board, but also there's an informal process around reflection and question and answer around that. We don't tend to kind of look at specific themes necessarily in terms of the board as a whole, but for example, myself as Children's Services, I could take a particular theme to that board if I wanted to. It's not prescriptive in the sense that I have to present I present certain information around safeguarding, but could also add in a theme if I felt there was an emerging theme within Children's Services that I wish the board to know about. So in terms of your question around homeschool education, if you were curious and more interested in that, wanted to know more information from Education Services, then their representative would bring that information back into the board, or provide that information for a discussion as part of the board, if that makes sense.
Okay, and Councillor Shan, what's your perspective on this, please?
Thank you, Councillor Amanda. So from a cabinet perspective, I would say it works the way that you suggested, where we get detailed reports to read before the board and in other cabinet meetings, and each of us comes in. You know, we do that work individually, obviously at home before the meeting, and we each come in with our own questions and the things that we're particularly interested in and the things that we particularly want to deep dive in and understand better. So across all of us, I would say you get quite a broad range of digging more deeply into things and finding out further information. I don't know if Richard or Sandra would have a different perspective than that, but that certainly would be my perspective on how it works.
Thank you. Richard?
Yeah, thank you. Yeah, I think it's a very good question, Amanda, and I think it's a question which the Audit Commissioner are asking in terms of their update and their review of where we are, and I hope we'll have that report very soon. So there's no point in having a board meeting that lasts for 5 minutes and rubber stamps a load of stuff without challenging it. The last meeting, I think Sharon, Sian, Sandra may correct me if I'm wrong, lasted for 2 hours. I think we used the maximum time available to us. And I came away from it thinking it was one of the best meetings we'd had, because it was very full, with a lot of very full discussion from which I learned a lot, and felt that the reports were being properly studied and challenged. But I think it would be nice if you had a way to check that we were doing that properly, and maybe we need to consider how that happens.
Okay, thank you. Well, that's something for us to think about. Councillor Gareth?
Yeah, thank you, Richard, for that assurance that it was a full and good discussion at the board. But in my view, the way you should actually reflect that is in the minutes and the reporting, which we've got now, that's going to Cabinet on Tuesday. And that, in my mind, that doesn't show, you know, from what we've got in front of us, I would have said that was an half an hour meeting maximum. You know, I think there needs to be a lot more, and I understand we don't need to overwhelm people with information, but this is a key issue for the authority. Safeguarding of children and vulnerable adults is, in my mind, one of the priorities for the authority. And I'm sitting here thinking, does this give me the assurance? And before coming into the meeting, I would have said no. After hearing what Sharon's told me, I'm more assured.
Yeah.
But we need to see that reflected in writing, in my mind.
Yeah. Thank you. Okay, well, you've got our perspective on that. So if we could have that as, you know, not necessarily a formal recommendation, but I think that it's something for to go away and think about how you reflect, how you demonstrate how robust you've been in those meetings, so that, you know, you're actually showing your effectiveness. That, I think that would be good. But yeah, we can think about how we can measure that as well. that would be helpful. And I don't think there's any other questions on the corporate safeguarding report. So on that note, thank you, Councillor Richard and Sharon, and for other portfolio holders for chipping in on there. And Richard, I know you've got to go by 11, so hopefully that's given you 10 minutes to get to where you need to go to.
Great. Thank you
And
very much, Amanda.
that's okay. And let me just go back to the next part of my agenda. And on that note, we'll move on to the prevention of falls work. We've got a presentation which Sharon Fruin is providing. And this is something that we have asked for as a committee in order to understand the type of work that goes on from a prevention perspective rather than a reactive type work. So on that note, Sharon, is it not just you, but is there anyone else who is feeding into this, or are we hearing?
There should have been our lead OT on this, but she's unfortunately not in work today, so
Okay.
unable to attend. But I do have all of her notes to aid me.
Okay. Okay. Well, if there's anything that we had a pre-discussion and we thought we have got quite a lot of questions, and if there's anything which you're not able to provide an answer on, it might be that we look at this in more detail in terms of like a task and finish type working group. But we will wait to hear your presentation first. We've read what we've had, but I'll hand over to you. Thank you.
Okay, thank you. Just try and share my screen. Bear with me. Can I just check if that is sharing now?
Not yet for me.
Oh.
Nope, still no. Yes, starting to. Oh, someone's got their mic. Needs to go off.
Can you see my first slide?
Yes, Sharon.
Yes. Yeah.
Yes, okay, great. So, Bore da pawb, this is a presentation, as Chair has explained, on our falls prevention work in Powys. And I need to say this is a collaborative approach with colleagues in PTHB and housing and the third sector. So we've all come together to tackle these issues through a collaborative approach. So falls are the second leading cause of accidental injury or death worldwide. They have serious consequences for people's health and well-being. The Welsh Ambulance Service are frequently called out to people in Powys who have fallen and can't get back up. And if people are injured, they often need time in hospital to treat their injuries. And if they need care and support following the injury, the discharge time can be quite lengthy to organise. Once people have fallen, they can lose their confidence, become less active, and become more dependent on others to care for them, and at risk of really losing their independence and not being able to stay at home. All of that is a significant cost to them and their independence, but also a significant cost to the health and social care sector. There's some statistics there of 1 in 3 people over 65 will fall, and 1 in 2 people over 80 will fall. And as you all know, the demography in Powys means that's a significant issue for us in particular. So routine inquiries and assistive technology, they come through to the assist team. When the inquiry comes through, the team routinely ask people contacting the service if they've fallen in the past year, even if the call isn't around falls. They include details about the falls, if they're worried about falling at home, or if they have any other concerns about their environment. It forms that natural part of the what matter conversations that the call handlers have with people every time they call. Assistive technology such as care line alarm or falls alarms can be provided at this stage to enable people to contact help if they should fall, and we prescribe those at the front door. And this is vital to prevent a long lie on the floor before the Welsh Ambulance Service arrives, as long lies can have very serious health consequences for older people, such as dehydration, pressure sores, and may lead to unnecessary hospital admissions. If people are reporting that they're at risk, then they are also encouraged to self-refer, or they're supported to refer by our call handlers to Powys Teaching Health Board's Falls service. And of the excuse me, and of the 720 individuals receiving technology, 361, so a significant proportion of that was to support with technology-enabled care to manage risks associated with falls. Those equipment can include wrist-worn detectors, chair and bed occupancy sensors, etc. Oh, sorry, I'm going the wrong way. Apologies. I'm so used to doing presentations in Teams. It's slightly different on Zoom, isn't it? So the process starts with that multifactorial falls risk assessment. It's conducted for each person. That includes assessing their falls history, any gait or balance issues, muscle weakness, any concerns around blood pressure, nutrition and hydration. Then the tailored interventions are then provided based on the results of that assessment, and then any necessary referrals onto relevant professionals will be made, and hopefully addressing any any underlying causes, which will then increase the likelihood of the person falling. So that's a real preventative way. If we can address the underlying causes before they become an issue, then we reduce the risk of falls. So as I said before, this is a collaborative effort between Powys Teaching Health Board, ourselves, housing, our community equipment store and the third sector. And some of the things that we do are around tailored interventions around recurrent falls, doing mobility assessments and rehabilitation to make sure those people who are at high risk of falls, that we can identify areas that of support that will reduce that risk. There's work undertaken around strength and balance training. Powys Teaching Health Board are currently setting up new specialised training sessions at the present. Some of those are an example of that is in the Confident Strides group in North Powys, but there's other examples across the county. Identifying hazards and making modifications within the home is essential. So we work with, like I said, Powys Teaching Health Board, the sensory impairment team, housing services, care and repair, where we work with people to understand what they need, provide small, medium and large adaptations, and adaptations that can improve accessibility of homes and significantly reducing risk of falls is an absolute priority. So for example, provision of grab rails, ramps, level access showers, lighting on stairs, stair lifts, all of those things will support somebody and reduce their risk of falls. Home adaptations support people's independence and their ability to remain in their home. This can significantly reduce their risk of losing their independence. It can reduce care costs for local councils, because the longer people are remaining independent, the longer that we keep them in their own homes, and the less likely they are to go into residential care. According to a report by the UK government, adaptations such as installing grab rails, ramps and stair lifts can save councils up to £4 for every £1 invested in those pieces of equipment. And that's because, as I said earlier, this prevents people falling and other accidents, which in turn reduces hospital admissions and the need for residential care. Adaptations can also facilitate hospital discharges quicker and support domiciliary care providers to be able to provide support in a safe environment. We've then got the community equipment provision. So we work with the community therapy teams, the district nursing services, occupational therapy and sensory impairment. They all access our Millbrook, which is our community equipment store. So that mobility aids, chair raisers, toilet frames, community beds and other equipment is available to meet needs and reduce falls in the community. In 23-24, the Community Equipment Service visited 5,760 individuals in Powys. So they're reaching out to a lot of people. Care and support. Obviously, we've got our domiciliary care providers, but we've also got our sensory impairment team who actually go out and do work with older people with visual impairments to improve their mobility and reduce the risk of falls. That's not only through aids and adaptations, but that's also through mobility rehabilitation and encouraging everyday activities in the community. We've then got our reablement teams and the social worker teams who work with individuals and their carers and the care agencies to ensure that the right level of care and support is provided so that risks of falls to inadequate nutrition and hydration are reduced whenever possible. The majority of people who receive a reablement intervention see a decrease in their package of support. So it is a priority service and has a huge impact. The teams also work really closely with the GPs and district nurses through the virtual wards to ensure medication reviews and adjustments take place so in a timely manner, because medications can significantly increase the risk of falls. If somebody's feeling a bit woozy or not themselves, or have got altered perceptions, side effects from any medications they're taking. So it's really important that those are reviewed regularly and any issues addressed. Activity and the importance of exercise and activity. So regular exercise has numerous benefits, as we all know, but it's especially for older people. It strengthens muscles, improves balance, stamina and flexibility, and exercise can significantly reduce the risk of falls and serious injuries. It's common to become less active after a fall, so it's even more important that people have access to activities, because that can lead to further weakness and instability, especially if somebody's feeling lost their confidence because of the fall, or even their family have lost confidence and are worried because of further risks of fall. So staying active is crucial to regain confidence and maintain strength. The National Exercise Referral Scheme and access to fitness schemes run in many of the leisure centres in Powys, and we're also expanding that and looking at ways that we can expand that to other community venues, so it's not dependent on leisure centres, but it's actually got a wider access point. The scheme can support people with health conditions to stay active and reduce falls. And it is recommended that older people participate in 150 minutes of physical exercise per week. And in addition, strength and balance exercises are undertaken at least twice a week as per the NICE guidelines. So access to leisure activities can help people stay fit and active. It also, as we know, reduces isolation. But then in doing so, the number of older people at risk of falls can be reduced. This increases people, maintains people's independence within their own home and reduces the cost of further higher levels of support from health and social care. It's important to say that it's not just those referral schemes that encourage activity, but we all should be encouraging any form of activity in our older population. And we do talk about that with our domiciliary providers as well, to make sure that people are encouraged to get up and move around within their own homes, and we don't create dependencies on care providers. So in conclusion, working together in the health service and third sector and leisure sector is crucial to reducing falls. Implementing all of the above strategies can help reduce falls among older people, enhancing their safety and well-being and maintaining their independence. There's probably services that, well, there are services that we haven't mentioned in this, and it's really important that we all support and raise awareness, support people to raise awareness. And in the last slide, I've provided some contact details for further information if people want them. So that's our assist line, the Millbrook Community Equipment Store, the Falls Prevention Service, and they will be able to provide a huge amount of detail around what activities are happening across the county, and then our care and repair service.
Okay, thank you, Sharon. Councillor Shan, did you want to add anything before we go on to questioning?
No, I haven't had a detailed update for a wee while yet. So I was writing down some questions to pursue and some more more detail for me to obtain outside
Yeah.
of this meeting. Thank you.
Thank you. Thank you. I think this came onto our work program because we're interested to know, well, what's going on, which you've really comprehensively covered, which is great. But also we're keen to know how you measure the impact of the work that goes on in this area, and how that then impacts outcomes on people being able to retain in their homes for longer, retaining their independence, how you measure that, and any data you have surrounding that. So I know we have got some questions on that you may not have the information to today, but before I sort of ask any of those questions, I think I'll hand over to other members who have got other questions in certain areas. So members, please put your hand up. I know some of you indicated you wanted to ask questions. Councillor Ben, thank you. I know Councillor Ben's got a question on the adaptation side of the work. Ben?
Thank you, Chair, and thank you for the presentation. So I know how important the adaptations at home can be to help people stay independent and reduce falls. So my nan was living independently and driving until she passed at 96, and she was able to stay independent thanks to these adaptations and the technology. So the question really is, following a couple of points, following a fall of one of our residents, what adaptations to properties does Palace offer? And I know you covered that a bit. Secondly, who completes this work and what is the budget? And then how long does it take to install these adaptations from knowledge of the fall to the installation?
Thanks, Ben.
Thank you.
Sharon?
There's a huge variety of adaptations, and I think I mentioned some of them in there. So we've got the normal stuff as grab rails and handrails and chair raisers and ramps. There's bigger adaptations through the Disabled Facilities Grant, as in wet rooms and walk-in showers, etc. All of those things are available. So there's a huge wide range, and we're currently waiting for translation for an aids and adaptations page for our website, so that people can see a whole range of aids and adaptations, small adaptations that they could actually purchase themselves. We have some, the length of time will depend on the pieces of work and the kind of the work that's necessary. We do have timescales around immediate delivery, 24-hour delivery. We can have 24-hour requests, and other longer pieces of work have other timescales. The budget, there's several different budget sources from several different grants. I wouldn't be able to tell you, sorry, Councillor Ben, off the top of my head how much that adds up to, but I could get that detail to you.
I think it would be helpful. I think we are going to want to come and do a bit of a deeper dive on this, and in that deeper dive, it would be good to look at an analysis of the costs of adaptations and where those budget streams come from, whether they be grants or whether they are automatically part of your budget that you have, and then also an analysis on the cost efficiencies that those then lead to. If that data is available. Councillor Ben asked about time frames, just a follow up on that, and Ben possibly wants to come back on it as well. But are those time frames, whether they be 24 hours or longer, are they a challenge? Are there enough resources to meet those time frames? What's your perspective on how efficient it is from when you put in these requests?
I think feedback is it's pretty positive across the whole. We do have some issues with some pieces of equipment sometimes, and that's usually availability, marketplace availability. But we do have a really well-stocked store, and usually it's not too much of an issue. That's not raised with me. And they do monitor the timeliness. They have all that detail. They'll track the referral and point of delivery, and there's a board that oversees the efficiency and effectiveness of the community store and the provision of the aids and adaptations.
There's a board, sorry, did you say?
Yeah, they're the community equipment store board.
And who sits on that?
That's led by one of our officers, and there's members of the health board, our own staff, Millbrook, Care and Repair.
Okay, great. Ben, did you want any follow-up questions on that?
Yes, thank you, Chair. Just finally, in regards to the wrist and neck fall detectors, from experience of those, I know my nan, she was terrified of accidentally setting off by, constantly wearing it. So we would every month get her to set it off to test it and get her used to it to get rid of that anxiety. So residents haven't really got that network around them of support. Do we offer anything like that just to get them used to the technology? Just so they're not afraid of using it or setting it off by accident?
Yeah, we do. We spend time with each resident going through their pieces of equipment. That would be then reviewed as well as part of their review, to make sure that they're happy with using it. We'd seek feedback from families often as well around how happy they are. We have some canary systems that monitor movements, etc., that provide real reassurances for extended family members around their loved ones who live alone.
Thank you.
Thank you.
Just on the adaptations point, how does this, I know you're looking at it for sort of preventative stuff, but if it is a reactive adaptation for slips and falls and someone's gone into hospital, how does this marry up with the hospital discharge teams and how quickly they can get adaptations for further preventions?
That's usually where we get the 24-hour requests from.
Right, okay.
Yeah.
And are they're
completely linked. The discharge teams are linked across the OTs and the reablement teams.
And you feel assured that those 24-hour requests are usually met, and it's not that holds up discharge.
Yeah, absolutely.
Discharges.
Yeah, very much so. It's not very often that I sit on the twice weekly discharge meetings at a strategic level, but I also sit in the patient flow meetings on a weekly basis, and I think in the time I've been here once, there's been a concern raised around equipment.
Yeah, and I guess there's other adaptations which wouldn't be to do with slips, trips, and falls, which maybe come under a different stream, and that's can be more complex, can't it?
So the disabled facility grant would do those larger pieces of work where there's significant adaptations within the structure of the home.
Yeah,
and that can be more timely.
Okay, thank you. Thanks. Councillor Chris.
Yeah, thank you, Sharon. And likewise, the presentation was further enhanced with your presentation because you've added more detail into it, which didn't necessarily come across when I first looked at the presentation. So thank you for that. Couple of things, just picking back up on the equipment of what Ben had raised. When we've provided someone with equipment and they then no longer require it, do we collect it back? And is there then a process around the infection control side of it so that it can then be utilised elsewhere? Because I am aware of some authorities, not here, but elsewhere, where I've still got equipment from when my father died nearly 12 months ago, and it's still not being collected. And to me, I just think that is a huge amount of waste on there, and that could be delaying someone's discharge home and getting them back out. And I just want to make sure we've not got any of that. One of the other slides that you put in the presentation was about the care line alarms and people on there. And I'm aware that digital voice came in like a while back, which sometimes will stop those systems working. Have we addressed that, and are we assured that if someone does need those alarm systems and they utilize them, that they are working and they will work, and that on there? And then it's you talk about a collaboration and cooperation, and I think that's the way forward. What I don't see, and I think would be helpful, is to understand those arrangements more fully. For example, and I'll go back because my background is in health, but I used to use Section 33 agreements for some things where there were shared pots of money to be able to do that. And I'd like to then be able to see what's coming in from those different partners so that we can then say, this is what this service is bring into the table, and how many falls have we had in the last 12 months, and have they reduced down? Because I think you mentioned 361 people were signposted to false services. So of those, had any of those fell? Had any of those not? Were they new people that had fell that we weren't aware of? It's just trying to get a little bit more of an understanding of how this all works, because when you're trying to do stuff proactively to prevent, it's sometimes more difficult to measure. But I think this is essential because it's only by working in partnership and collaboration, as you say, we're going to make a difference, and you are making a difference. And I want to be able to recognize that and be able to celebrate that we are doing that. And I'll stop there, Chair.
Thank you,
Thank you,
Councillor.
Chris. Sharon, there's quite a lot there. Did you want to sort of unpick it in parts?
I'll try and answer what I can, and other bits I will have to get back to you. Apologies, Councillor
Okay.
Chris. So
No problem.
collections, I know we do collections. I don't know if we collect the full range of equipment, but I can find that out. And there are robust IPC measures in place. The digital switchover, that is a question that Councillor Gareth has asked me separately via email, and it is something that we are reviewing constantly. There is measures in place to ensure that that the equipment works. And I know in the performance report there was some concerns raised over some issues with some of the sensory impairment equipment that we're reviewing now with the manufacturer to make sure that we can reduce that the impact of that. Yes, that's work is being done. Understanding the collaborative, there are different pots of money. We access central grants, but there is a budget, a combined budget from PCC and the Health Board that goes into the equipment store for different levels of equipment. I couldn't tell you how much that is off the top of my head, Councillor Chris, but I do have that details that we could share that with you. And I know the falls, there is a falls group that is monitoring and doing the research into how many contacts, how many people they've supported went on to fall. I don't have that level of detail, but we can provide that.
Okay, thank you.
Anything else, Sharon, on Chris's questions that you're going to be able to sort of come back on? Do you think it will be sort of in written format, or do you think it's something that is it quite detailed? What's the best way from your perspective of getting this information back to us?
We could get a written, we could answer that in writing.
Okay, that would be great, because then I think that will help us consider whether or not we want to do more of a deep dive. Chris, did you want to come back on it?
Yeah, I mean, as you've just mentioned, Chair, we are looking to do a deep dive on here, and there may be some merit. I mean, obviously, Sharon would get a flavour of some of the type of question that I am bringing to the table, but it may be worth, once we've pulled that little group together that's going to do that, look at some of the key questions that we want and provide that to Sharon, where she can then extract that in to give us a more comprehensive overview of what that is going to look like.
There are a lot of people involved in this work who have got the minutiae of detail that I don't. That I'm thinking, we've got our lead on equipment and technology. We've got our lead on the falls prevention. We've got PTHB, the PTHB groups. There's a lot of work going on. They would be able to provide so much more detail. And it is a real shame that Diane's not here today, because she would have been able to do that.
Okay, thank you.
Thank you, Councillor Gareth.
Yeah, thank you, Chair. Can I start by saying I think this is a really good piece of work. I really support anything that's going to try and prevent the number of injuries, falls, etc. And I know from the support of equipment, I know I had a close family member who was requested some equipment, and that was delivered and fitted very, very quickly. So now I've got a couple of questions. One is, I attended an event in Brecon recently where there is a member of the care and repair service. It's from a third sector, and she was saying that they're running out of budget for doing the physical adaptations to the. Is there anything update on that we can, because you mentioned, Sharon, that for every pound we spend, we save £4, and I assume if we spend £1 this year, we're saving £4 this year, £4 next year, £4 a year after. So it's not just one for 4; it's most likely one for 15. And the other question I've got is around. I was the lead member on the review of leisure services provision, one left on the data. The one aspect that I felt wasn't included was any input from adults and children's services around the benefits of leisure and you mentioned it now. The one aspect you haven't picked up on leisure, I think the best leisure activity is walking, but that's me. And there's lots of benefits that can be done from that. And I'm just wondering whether you can give us an update, especially around the care and repair budget for that, and how we're going to meet that. The indication I had was that come Christmas there won't be any money from January to March, and I don't know what the overall budget is, but to me it sounds like it needed quite a small input in terms of budget to actually meet that need for the rest of the year. But also then we need to look at it and say, how can we actually fund that properly for the 25-26 and ongoing years?
Yeah. Quite timely, Councillor Gareth. We had a meeting this week to look at the budget. We had a similar issue last year. The amount of pieces of equipment we're prescribing is going up year on year, which is a good thing. But there is significantly increased demand, and we're just currently working out which funding streams that we can pull from to cover the gap in funding. We did it last year, and I'm confident we'll make it work this year as well. I'm just waiting on some figures.
Great. And leisure, have you been involved in any discussions around the review of the leisure services?
Yes, we have regular conversations around the leisure review. It feeds into the work we're doing in day opportunities as well, and our place-based planning around making use of community assets across the county for a variety of different activities that possibly they've not been used for previously, and making sure that we're actually connecting those activities up. So we've got we can provide adequate information to members of the public as where they can get those access to those activities. Yeah, we're regularly in conversation with Jenny.
Right, thank you.
Thank you. Ben, your hand was up before, but now it's gone back down. Has your question been answered?
I was just really thinking what other councils may think of basically an annual report or a graph with monthly data of equipment availability and stock on order, like Councillor Chris said, collections of used equipment and usage in general. Would that be something? There's probably the data's probably already there. It maybe just needs to be put together. What do you think?
The data is there. I can share that with you easily.
I think it would be good for us to see that the data that would show where, for example, if a budget is running out or if there's a lack of availability. So we would just need, anything where it would want us to ask questions on what assurances you're being given as head of service, rather than a complete overview of the whole lot.
No problem, Chair.
Would you agree, Ben?
Yeah, absolutely. Yeah.
Yeah. Thanks. Councillor Gareth.
Yeah, and apologies, Sharon, before I ask this question, it may be one that's impossible to answer, or difficult to answer. I was just wondering, do you have any estimate of what the savings are from care and health by doing adaptations in a timely way?
It's a really difficult calculation because often the cost reductions are elsewhere in the system with Welsh Ambulance Service, etc. And there is lots of data on that and modelling on it, which I could share with you, Councillor Gareth. I think the highlight for us was that for every £1 spent, releases £4 or
Yeah.
£4, whichever. I may have got that the wrong way round.
Yeah, no, you got it right round. You know, every pound spent saves 4.
Yeah, saves 4.
Yeah.
Yeah,
Which is what we should be doing from the preventative side.
absolutely.
I think, Sharon, when we come to look at this on our deep dive, it would be helpful for you to point us to where you would look in the monthly performance reports generally, where you would expect us to see the sorry, I'm not phrasing this very well. So if we're doing more to invest in upstream prevention, that means that hopefully there's less care packages need to be put in place, or of a specific type of care package, or less, more people remaining independently. Where would you hope to see those trends following through so that we know where to look in the monthly reports? Is that something that you can highlight to us?
That's something that's not there at present, and is something that we are looking to develop. As I spoke to you earlier about developing our performance reports, that's something that we'll be trying to capture in the new revised data set. It is very difficult to demonstrate it with an increase in demand, because often where we see a saving, that's eradicated by the demand, and the demand that we're seeing is usually more complex.
And or demography.
Yes, absolutely. Yeah. So it is very difficult to pull that out. And we're going to have to get better at that across the board. So
could you do it as a population percentage though? So obviously demand is increasing because we've got a high number of elderly people in Powys. And if you look at the previous ways the services that were put in place for those people previously, they would be more reactive. And so if it was measured as a percentage rather than crude figures, might that show a more obvious trend?
Yes, and it's something that we're looking at. There is modelling out there, so we're looking at gaining that kind of insight and applying it on our new data set.
Okay, great. Well, it sounds like it's part of a quite an exciting new sort of stream of focus, and from our perspective, well, and I like to see lots of upstream thinking, so I think it would be a good area for us to look at. Councillor Sian, do you want to add anything on your thoughts on this?
Yes, I'm just nodding along because it kind of speaks to the discussion we had earlier, really, about the deep discussions that go on behind the scenes that the public don't necessarily get an opportunity to witness or be part of. So these are ongoing discussions that we have around how do we show that the upstream work is having an impact and is successful and does work, prevention does work, when actually the gains that we make through the prevention and the successes that we have through prevention work in the measures that we currently have don't show, because so take a bar graph, for example. A bar graph might look static, like there's no particular improvement happening, but actually improvements have happened, but they've been evened out by the increased demand. So that's the work that some of the work that Sharon's referring to there is about how do we create measures that show the successes of prevention, despite the fact that demand is kind of evening everything out. And in some sense, some of that apparent static status on the graphs that show in the measures is a testament to our success, because if the prevention wasn't working, those figures would be going up, not staying stable.
In line with demography. Yeah,
absolutely. So we have to find a way of pulling out of those measures finer detail to show where the successes in prevention are happening. And of course, we need to preserve the prevention budget. We absolutely need to.
Yeah.
So
okay.
Chair, could I come in? Sorry.
Yeah, absolutely.
Just to give an example of that, we've seen an increase in the amount of residential and care nursing home beds we've commissioned this year, but we are currently supporting 50% of people being discharged from home directly to their own homes. Now, this time last year, that was 10%. So although we're seeing an increase in residential and nursing home provision, we're also supporting more people to return home. And some of that is because of the aids and adaptations and the reablement work that's going on, and our success at growing the domiciliary marketplace externally. So it may seem that there's more beds, but actually more people are also going home as well.
Brilliant. Thank you. Sorry, my screen just froze temporarily then. Sorry, Councillor Gareth. You're on mute, Gareth.
Yeah, sorry, Chair. Yeah, can I just follow up on that point that Sharon's just made about 10% being discharged home and 50% now? You know, that could be a very quick financial exercise just to actually cost what that is, not the cost, to show what that has actually saved us in effect, because if those 40% had actually been admitted into residential homes, that's, I assume that's a significant cost to be discharged to homes. The second part, the reason I put my hand up originally was to ask what discussions, if any, have you had around with the 110 town and community councils around how perhaps they could support in some of this activity, even if it, that, you know, they could fund perhaps some of the fittings of some of the adaptations, etc.
Sharon?
Yes, I don't think we've had any conversations with town and community councils around that matter, and I'm not sure. I'm not sure of the detail around whether or not it would be appropriate for them to be funding the aids adaptations, if I'm honest.
They probably wouldn't have the insurance in place as well for those kind of. But what about their role in signposting, though? I think there is a role to play, is there, in terms of.
Absolutely.
Yeah. Is there do you ever share information with community councils and town councils?
Yes, there's lots of information being shared through different sources in the locality, and I think some of the work that we want to do around our link officers is to be able to have that conduit to share more information.
Yeah. Okay. Thank you, Councillor Chris.
Yeah, I mean, just picking up on some of that, I think there may be a role for town and community councils to play, but I think we just got to understand it, because it's the more players you bring into the system, the more dilute it gets, and sometimes that can impact on quality and on safety. So I think it needs a more holistic viewpoint. But just coming back to the point of how you could measure this, we know that if someone has a fractured hip, they're going to be in hospital for a certain period of time if they've got to have an emergency surgery. And we know the cost per day. So in that sense, if you're then saying it's going to be 3 days that they're going to be in, you've got those on there. So by you saving someone falling, you're going to make a net gain in relation to that. And that gain is that if you don't put someone into a bed, that bed then is available for other treatment to be done, which can then be, costed. And that's again adding to your savings. We know that from the information you presented, Sharon, that there were 361 people that were steered to do some form of falls assessment. Of those, how many of them actually fell and required a hospitalization to it? So if that's none, then that's a positive. So on the if they've had a falls assessment, what interventions then needed to happen? Was that equipment, which again we can cost? and that then starts to offlay it. So it's a little bit of you've got to really go and sit in it and understand it to get into the detail. And I don't know if it's for this committee to do that or whether it's with officers and teams, but it just feels that we add in something else to your workload, and on the, because as they say, noses in, hands out, and I think you know, that's how we need to do it. But
Yeah,
we're there as being supportive.
I think I completely agree. And I think from Councillor Shan and Sharon's perspective on this, we don't want to create additional work. It would be good if you could have a think about how do you think we could be helpful here in terms of the deep dive we do? You know, is there something you would like us to look at in terms of you know, maybe helping the scrutiny process of how you measure effectiveness, or that kind of thing. So let's not make any firm decisions today on it, but it's something that, you know, we're open to wanting to do a deep dive on, as we've said a few times now.
Thank you, Chair. That work is done in a wider group. So I think it may be around how do we share that information to you as well.
There we are. Thank you.
Okay, thank you. I think that's all the questions on falls prevention that we've got. So thank you ever so much for presenting on that. Just going back to the agenda, we have an item on here which is monthly performance reports for both services. And as I said in my previous meeting, this is a standing agenda item now. And what our plan as a committee is for us to look at the performance reports in advance, and for us to present some sort of queries or questions to you in advance, and then at each meeting for you to come back and answer those questions or provide us with the information as we've asked. But it would, you know, be a way of us giving us time to do that. Before we get on to that becoming embedded in our program, we've asked for a bit of training so that we fully understand the context behind the report, because they're very data heavy. But what I've just asked both Sharon and Sharon today is, some of us have looked at those reports this time, and we've just got a small number of questions. You've mentioned that you are happy for us to ask those today. If there's something that we ask that you're not, you need to go away and get the information on, that's absolutely fine. I don't propose that we spend too long on this because we've only got 20 minutes left of the meeting anyway. But you've both said that you'd be happy to take a couple of questions just on the September report. So on that note, are you still both okay with that? Yeah, I can see nodding. Yeah. So councillors, I mean, I've got some questions on children's. Has anyone? Should we start with children's? Has anyone else got any other question on children's? Please put your hand up. No. Okay. So just a couple of questions, really, Sharon. Where you see in the performance reports that supervision has dipped, you know, what, as head of service, what would you do? What level of it reducing would concern you? So where would you expect it to be, and where would you start to get concerned? And then following that, if it reached that level, you know, what would you do? Because I just see it's, you know, it's down a bit this month, but does that concern you? I think it was at 78% of people had supervisions.
Yeah, thank you, Chair. You know, that's a really good question in terms of picking up the matters around supervision. Obviously, what we are aiming to get as close to 100% as is possible in terms of supervision. That some of the challenges in the summer months where we quite often see a dip is because of annual leave, when maybe a practitioner's on different annual leave to the team manager or the person that's supervising them. So I quite often in the summer, I see a slight dip in terms of that. What I would get worried about is that dipped well below the 70% mark. So if we're starting on a downward trajectory below 70%, then that would concern me in terms of that as an overall perspective. But supervision is just one format of conversation in terms of a practitioner with their manager. So I'm assured that there are many other forums in which communication takes place, whether that's around an informal conversation around a child or a family, whether that's within a team meeting, whether that's in a training event, whether that's in a mapping reflective session. So there are a number of different forums where conversations happen around supervision as a whole, but nevertheless, supervision is absolutely important. It's a key performance indicator. We want that to be as close to 100% as possible. Linking it back to our appraisals, where we had 100% appraisal rate earlier on in the summer, so about June time, that was amazing to get the 100% on that. So I am constantly assured that those things are happening, those meetings are happening, but invariably when it's a peak time around holiday, Christmas, Easter, summer, we invariably just see that slight dip because of annual leave. But it is something that I monitor and keep a focus on. In terms of assurance back, we have weekly performance meetings across all the service area teams. So supervision is brought up as one of those key performance indicators in those meetings. So it is tracked constantly. So, I know which areas have not had that supervision. I know which practitioners have not had that supervision. So I can keep an overall arching kind of assurance of it as a whole service perspective.
Okay, thank you. And I guess it's a similar question then on where you see that statutory visits are out of time. So for example, I think it's in box 30B, I think is it the care and supports visits out of time. It says, I think as a percentage it's okay, but it says 50 of them were out of time. And I guess my question is the same. Does that ring alarm bells, or what risk is that? And where would you start to ask questions, or where would you expect the supervisors to have already highlighted that to you?
Yeah, so again, our target is above 90%. So we are hovering just under or about there. So if that again was falling down to, if you look back on some of the trajectories around visits, they have dipped much lower in the past. So therefore that would concern me. If I saw a downward trajectory of quite a significant downward trend, that would concern me in terms of what that's about. But in terms of the overall perspective of visits per se, with our child protection figures, you will see that our child protection registration, so that's where any child that is deemed at risk of significant harm through that multi-agency decision-making progress, you will see that our child protection register is going on an upward trajectory. Therefore, there are more visits to undertake, there's more work to do, because it's all governed within a statutory timescale that a child has to be seen within 10 working days as a requirement. So we track that, which is why the data is really important. You will see that it shows the percentages of how outside that time scale is. So it's whether it's just 1 to 2 days, 3 to 5 days, or more than 5 days. So where the figure as was 5% for more than 5 days on child protection visits for September, that is something I would get more curious about, because that trajectory has gone upward. So it means that over 5 days, maybe that child has not been seen. So what is that about? Is that a particular resistance by the family, or whether that a capacity issue? Is it a demand issue? So we can drill down right to the specific worker, right to the specific team, to understand exactly what that's about. So I get that level of assurance back through on the cycle of the performance meetings back to me on a weekly basis. So if there was a particular issue with capacity in a team, we can then assess that and deal with that there. Quite often, the WICIS system, which is on its kind of outward journey for the service, has been down during the month of September. So that can sometimes prevent the recording of the information in a timely way. So generally, it's not that children are not seen, it's that the recording of the information of the visit isn't uploaded onto the system. So if the system does go down for periods of time in a week and a social worker has planned to record their information at that specific time, then they have to catch that up at a later date. And for me, it's important that the visit has only occurred once it's written up and recorded and placed on the system. So even if that goes out of timescale because of the recording, that for me, we've got to be more robust and have that in place. Otherwise, there's loopholes in the system in terms of performance. So for me, it's absolutely that visit hasn't happened if that information isn't recorded, isn't evidenced on the system in a timely manner, because then I can track where there's percentage increases or decreases, is understand what's that about, is it capacity, is it demand, is it a particular problem, and there's no excuses in terms of the system. We have to be more efficient at recording that information in a more timely way in the event that something goes awry in the process of seeing a child and visiting them and recording them. So I'd only get really concerned if there was a real downward trajectory dip, but actually it's something that I monitor week on week, month on month.
Okay, thank you. That's it from me. Councillor Gareth.
Yeah, thank you, Chair. Perhaps a question for both Sharons. Awful lot of data on the reports. If I was to ask you, would it be possible to have a top 5 or top 10 of those which you felt are the most crucial measurements within each of your services? Would that be a possibility to have as part of this reporting process?
I think so. That's a really good question, Councillor Gareth, for me, because I think some of the key things I'd like to draw your attention to in terms of the performance report would have been the increase of child protection registrations and that creeping up, because that then creates a kind of downflow problem in terms of capacity and demand in terms of managing that risk. You will see there's a graph in there about high cost placements, and it gives you a 12-month overview of the increase in residential placements, which has gone from below 6 million up to 10 million in terms of its totality about residential cost in terms of placements. So I think that there are kind of key thing, because it is a vast amount of information, as you said. So I think the front door is also an area of consideration. So there might be a way that if you felt that the report in its entirety is just like too much information in terms of what you absolutely need to scrutinize, then I would happily take away what you think were the key areas that you would like to consider. And it might be that I know that you're due to do a layman visit at the front door, which I really welcome. I know that's happening fairly soon. So therefore, the front door data would be of particular interest to you in terms of contacts to the front door, how much a percentage is going into the assessment team, how much is around information, advice and assistance, so that you can scrutinize that in terms of your layman visit. So there are probably smarter ways that we could look at the totality of the performance, but picking out some key themes that you feel that you just want to drill down to a little bit more, or that you're more curious about, or whatever that is. And I'd be more than happy to look at that in terms of whether that's a month on month, you want a top 10 of something, or whether it's scrutinizing something in more detail at a different meeting. So happy to hear from yourselves on that.
Okay, thank you.
Thank you.
I'd echo much of what Sharon said. I think I described earlier that we're looking at all our performance indicators in adult services. There's some key ones that are not there that I think should be there, such as the number of assessments completed. And there's something there for me around actually measuring outcomes for people, and more qualitative data rather than quantitative data. I'd be more than happy to look at that top 5 or top 10, but I'd also be happy to maybe focus on a theme every month if that was a preferred option, that we could take a theme and provide an overview of that rather than all of it together.
Okay, yeah, okay, well, perhaps we'll give it some thought on themes. Councillor Chris.
Yeah, obviously I haven't looked at the performance report that fully, so I will do that going forward. But you mentioned, Sharon, about WICIS, and I just wanted to get an update on it because it seems to have been going on for a long period of time. It may not necessarily be here for this meeting, but if you could provide me with an update of what is happening, because I know that there are other scrutiny committees where this issue has come up, and I'd just like to have a full update of what is happening because it's been promised for a long time and nothing seems to have happened.
Yeah, I'm happy to give you a short verbal update now,
Yeah.
Councillor Chris, and then I will take it back to Nina, who's leading on the WICIS programme, to provide a fuller report, if that's helpful, Chair, back to
Yes,
the
please. Yeah.
committee. In terms of where we're at, obviously WICIS is on a phased kind of decommissioning process, as we know. And where we're at right now is that we've gone through the tendering process of sourcing other particular I can't think of the word now. The particular suppliers who want to come in and kind of fulfil the duties of WICIS. So we've gone through all that tendering process, and 2 suppliers came forward as opportunities for the future, and we're now in the testing phase of those 2 suppliers in terms of the next step. So it has moved on in the last sort of few weeks, really, into that testing phase now of 2 potential suppliers to be able to be commissioned in the future. That's the headline news. I don't have the specifics of any more than that right now, but I'd happily take it away and ask Nina to provide you a fuller detailed report if needed.
So can I then just clarify that that system then will only be available within POWIS because it is the POWIS WICIS system, not a national system.
Yeah, that's right.
So
it's not a national system. So the
no,
decision has been made for POWIS to go independent
yeah,
in terms of sourcing its own system, but it's still going to be attached to the national board in terms of all the work that happens around systems as a whole for Wales.
yeah.
So the systems that have both come forward as potential suppliers are the ones we kind of expected to. Some of the local authorities are already using those systems.
Okay.
So we're just going through that testing process now in terms of that.
Yeah, I mean, that was my concern because of the potential risk issues, particularly when you're tracking someone, or whether you can then follow them through. I mean, if we're talking about looked after children, for example, and they move into different authorities, it's how we get that crossover, and it's reducing risk. And there was a big push to try and have one whole system that everyone was using, where you get consistency. This feels that we've gone the opposite direction, and that's a concern
it is
to
a
me.
change, but I would just like to assure you, really, in terms of that kind of data management of individuals, that would happen anyway in terms of moving to any new system. So even though another local authority might be on a different system, you can still track that information through information sharing protocols. Oh, so for example, if there was an adult offender that was a risk to children that might live in Powys and then might go and live in a different local authority in England or anywhere else, that information would still follow that individual. It would be tracked on databases across different authorities, whether that's health, police, social services. So just to provide you with that assurance, that tracking would still happen with that individual and those situations. But I appreciate your concern, and happily will take that back to Nina for a further discussion or report.
Yeah, yes,
Yeah,
please. I think
okay.
also because of where that is on the strategic risk register as well, and on there it notes that there's updates coming in the autumn. It would be good to know
Right.
from Nina whether or not that risk is starting to
Yeah.
reduce, etc.
But the other thing, Chair, is that as a scrutiny committee, I don't believe we've seen anything, not of what the new system's potentially able to do. So
we
it's
haven't seen
now
anything
that
on this for a long time.
we're making assumptions, and I fully appreciate and respect the reassurances that you're providing. I know a little bit more about this area than most because of my background. So I'm just disappointed that it's moving in that direction, but I want to see what the picture looks like so I can be assured going forward.
Maybe
Yeah, absolutely, Councillor Chris. And Chair, I think it's a really good question, and I'll happily take that back to Nina for a report to come back through for the next health and care scrutiny.
Yeah, thank you. I think that would be helpful because I think, Chris, you're probably going to want to know questions like what kind of testing and piloting and all those kinds of questions. And a year isn't really a long time in this kind of trajectory. So yeah, let's keep that on our agenda if we can make a note of that as a on our minutes, please. And I can't see any other hands. Anyone else? Any Councillor Shan or Councillor Sandra? I can't see. Is Councillor Sandra still here? I've lost all the pictures. Anyone want to come back on anything? No, I can see you now, Sandra. Sorry, I lost everyone's little heads. Okay, right. Well, oh, Councillor Shan.
Sorry, I was hemming and hawing about whether to come back in with this, and I was going to contact you directly, Councillor Amanda, but I will say it since you've invited me back in, and that's going back to the previous discussion around potentially looking at drawing some key themes out of the monthly report and doing some deeper dives. There's also something there for me around the potential of the monthly report to also show how things are operating as a system. So where savings are made in one area, what impact that has on another part of the system, and where prevention work is done in one part of the system. So it might be under hospital, where we might then see impacts, good impacts, and further successes under, say, the community heading. So there's something there for me about the whole picture not being lost as well. Of course, it's up to you what you do as scrutiny, but it was just really a suggestion as well as another thing that could be done to make these monthly reports really robust and useful.
Yeah, I think we need to give it some thought. I think we mustn't lose sight of the reason why these reports were created in the first place, in that they weren't there pre-2018, and they need to still remain a way of any of us as councillors and heads of service being able to see where alarm bells are starting to ring, and not being, you can't see the wood for the trees because of the amount of data that's in. So do we have different performance reports for different purposes? I think, but I think we need to give it some thought, and perhaps we need to have an offline discussion, maybe after the budget, given where we are in terms of the timeframes. But if we plan to do what we're going to do with the performance reports at the moment, and then it can be a flexible, moving beast in terms of how we scrutinise this. Thank you everybody, and thanks everyone's contributions today. We'll just if portfolio holders and officers want to leave, that's great. We'll just go into private session now, just to have a quick discussion on work programme and committee reflection.
Thank you very much.
Bye, everyone.
Thank you.
Bye.
Thanks.